Hi friends, have you ever checked your blood pressure and then noticed that it was normal and wondered, maybe you can stop your medications? Well, according to Natty Orb 934, by all doctors' opinions, you need tablets. Is that really true? So in this video, let's talk about what medicines can or cannot do for your high blood pressure. And I'm also going to share with you what you can do that can actually be more effective than any high blood pressure medications. But before we talk about that, can you ask your mom or maybe your grandmother what she was doing on April 11th? No, not this year, but in 1945. That was a day Franklin Delano Roosevelt is why we even have blood pressure medicines. And yet, despite 200 plus blood pressure drugs, we have access to us today. More than 2,000 Americans will have a stroke today. No, it's not this year. It's not this month. It's literally today. My name is Dr. Lou, and I've been a physician for almost 30 years. I have helped tens of thousands of people with high blood pressure and its complications. And I'm compelled to make this video, not to scare you, but to empower you, because there are plenty of things that you can do to reduce the possibility that you're going to be a stroke victim, simply because strokes are preventable. So in this video, we're not only going to talk about why normal blood pressure can be misleading and what medicines can or cannot do for you, we're also going to talk about how not to suffer the same fate as FDR by reviewing his public medical records. Well, actually, what's left of it? Because apparently somebody stole it. It's been missing since 1945, but I've actually read enough to know what caused him his stroke. Now, despite our medical advances, every 40 seconds, another person in the United States suffers his same fate. And if you think about it, that's every 3 minutes and 14 seconds, someone suffers from a stroke. And even if you're a survivor, your personality changes, your body changes. That ripple effect doesn't just change you, it changes your community, both at work and at home. And that's why blood pressure is not just a number on a cuff, but it's still super important that you know that number on this cuff every day, and for some people, multiple times a day. So let's go over what's really normal. Now, most people think that the lower, the better. But if it's too low, you're going to pass out too. And just like everything else in life, there needs to be a balance, because blood pressure, it's the force of blood pushing against your arteries from your heart. This is super important. Your heart pushes a pressure that makes the top number, systolic blood pressure, the pressure when your heart is squeezing. And the bottom number is a diastolic pressure, the pressure when your heart relaxes in between beats. Now, the guidelines to what is considered normal is a systolic blood pressure under 120. This is data following 1 million people. For every 10 points higher in systolic blood pressure, no matter your age, your risk of heart disease and strokes increases, with the greatest increase happening in those who are younger. So the definition of high blood pressure or hypertension, it may have changed, because in the past, stage 1 hypertension was a number above 140, and now stage 1 hypertension is a number above 130. Blood pressure isn't a fixed number, and it will change depending on literally your environment that you make inside your body and your mind. So you can just think a certain way and it can change your blood pressure. And you can also change your blood pressure by taking medications, or you can change your blood pressure by how you're moving your arteries or changing what you're eating and drinking. At 1 Millets, he had stage 2 hypertension and he started drinking beet juice, eating beets for 2 weeks, and his blood pressure finally got to an almost normal number. Thank you for sharing at 1 Millets. 120 over 80 is so much better than 165 over 110. He should be super proud of himself for figuring that out. Now, if you decide to try beets like he did for yourself, you should really talk to your own medical provider, especially if you are on medications. Food like beets work. It may not work as quickly as big pharma medicines. These work within minutes, but they can work if you eat or drink enough of it. And I have seen people bottom out their blood pressure because these medications, they prevented their own body from adjusting to their new normal. The effects of the nitrates in beets, which become nitric oxide, a molecule that relaxes blood vessels. Now, beets, they work because there's a hidden partnership between plants, your cells, and bacteria. So the nitrates in beets has to meet the bacteria on your tongue. And those bacteria help you turn it into nitrite, the raw material your body uses to make nitric oxide. And nitric oxide is one of those molecules that tells your arteries to relax, your nervous system to chill out. So when you eat beets, you're not just feeding yourself, you're feeding the tiny pharmacy in your mouth. Now, and that's why it's important to not use abrasive mouthwashes that kill like 99% or 99.9% of the germs in your mouth. However, what do you think is going to happen to @1 Millets to his blood pressure? If he stops drinking and eating beets? If he changes nothing else, then most likely his blood pressure will just go back up. Why? Because his blood pressure only went down because he changed his diet and he added beets. Nitric oxide is not something that the body can store. It needs to be made fresh for it to work. That means you have to constantly be eating it. You have to find foods high in nitrates. But it doesn't work when you eat nitrites in your deli meats. Don't get confused. They're very different. Nitrites are packaged with protein in the deli meats. They're used to preserve that protein. That's basically a chemical preservative, whether they're added or they're from natural celery juice. In fact, deli meats do the opposite to your blood pressure because there's a reaction with the nitrites and the protein before you even eat it. And that will elevate your blood pressure through several mechanisms, including all the salt that they add. And that's why your blood pressure constantly changes throughout the day depending on your food input. And food is not just calories. Every meal sends chemicals throughout your body. So if you eat too much, a heavy meal, a sugar spike, caffeine, excess salt, or you're always overeating, then all that pushes your nervous system towards higher alert. That raises a molecule called norepinephrine. And norepinephrine is made to tighten blood vessels. And when you tighten your blood vessels, you make your blood pressure harder to relax, to come down. But you don't have to eat to talk to your nervous system. For example, I can show you a coyote in the wild. And if I put you with a coyote, your body will prepare to run. And that signal is directly from your brain, your nervous system. Or let's say you get in an argument with your spouse. That anger that you feel, the reason why you're yelling, that's your nervous system telling you to do so. These are stress responses that get activated by your sympathetic nervous system. And when you activate that, you increase your norepinephrine. That can elevate your blood pressure. And unfortunately, if you stay scared, anxious, angry, etc., all these negative emotions and moods, your body won't let go of the stress. And then it stacks up to higher and higher blood pressure. So even if this stressful event is over, your body may still feel stressed because it hasn't learned to let go. So let's say you get high blood pressure because something traumatic happened, whether you heard bad news or you just simply believe your day is all messed up. That stress response will cause norepinephrine to surge to do lots of things to your body, including increasing your blood pressure. Doesn't sound like it's healthy, does it? Look at this chart from FDR's blood pressure. And look what happens to his blood pressure after a major world event. D-Day, Election Day, and Yalta. The graph keeps going higher and higher, huh? High blood pressure stacks on each other unless you can stop the stress input. And unfortunately, there was no blood pressure medications available at his time. And he obviously didn't find any effective ways to de-stress, or we wouldn't be talking about his high blood pressure. He also didn't have the right doctors, because if he hooked up with Walter Kepner, this would be a completely different story. His blood pressure was almost at 350 millimeters of mercury at the time of his stroke. Now, I've never seen anybody alive with that kind of blood pressure. So logically, physicians believe that if they can calm the nervous system, they got themselves a successful blood pressure remedy, right? And that is actually how the very first blood pressure medicine worked. Risperidone. It wasn't a designer drug. Risperidone actually came from a plant. In India, the Rauwolfia or Sarpaganda plant that was traditionally used in traditional medicine to treat insomnia, agitation, and severe mental disturbance, right? It worked on the nervous system. So risperidone works by turning down your sympathetic nervous system by depleting norepinephrine. The same effect that could be achieved through deep box breathing, massage, getting at least 7 hours of sleep, maybe going to a comedy show, moderate exercising. All of these work much better together than by itself alone. However, you need norepinephrine to be awake and to feel energized. Too little can cause sleepiness, dizziness, fatigue, nasal congestion, slow heart rate. But you lower your blood pressure. Oh yeah, did I forget to tell you it can cause an upset stomach and diarrhea? Oh, and depression. Is that worth it? Now, I don't know what would have happened if FDR would have been offered some risperidone. Maybe he would have taken it. Maybe he would have been asleep on the job. And if that happened, he probably would have quit the medication. And that's why we don't prescribe risperidone anymore.
Hi, friends. I am so thrilled that you want to take charge of your health and take charge of your food. Now, I know nutrition can be complex, but it doesn't have to be. And I'm here to support you in this lifelong journey. So if you point your camera app to this QR code, it'll take you to a link for a free handout that I created just for you. And if you like it, if you want to see other handouts, please go to the link in my show notes, and then you can leave me your feedback on what I could do to help you in your journey. Okay, back to the video now.
And yes, at Sunray 591, stress syndrome can cause high blood pressure, and FDR proved it. And that's why it's really important to de-stress your body every day. This is not a once a year thing. So when a person gets sick, it never happens in isolation. It affects the people who depend on them, love them, work with them, and follow their lead. And the more public your role is, the larger the ripple effect. So when a president suffers a massive stroke, it doesn't just affect his family, it affects a whole nation, the entire war, the economy, and the future of healthcare itself. I mean, think about it. So a few months after he passed, we dropped a couple of nukes across the Pacific Ocean, which like over 200,000 people instantly. That was Truman, who then signed the National Heart Act, and he created the National Heart Institute, which then funded the Framingham Heart Study in 1948, which finally established the detrimental impact of high blood pressure on our health. And that is why we now have over 200 medicines to address high blood pressure. But none of that was around for FDR to benefit, because during his time, that's not how they treated high blood pressure. Now, that seems like a logical conclusion, huh? But that's not why FDR had high blood pressure. And this is not a cure for high blood pressure. Although our modern day medicines, I admit, would have been a very effective treatment as a bridge to buy him time. But he still would have needed to fix his root cause. So let me explain. Let's go back to the original question. If a person has high blood pressure and then gets treated with medication, and then their blood pressure is normal, should they stop their medications? And this is a very common question that I get all the time. So instead of directly answering that question, I'm actually going to ask you questions so that you will help yourself answer your own question. Now, why do you think your blood pressure is normal now? If your blood pressure is normal because you're taking medications, then what do you think is going to happen when you stop these medications? Logically, your blood pressure is going to go back unless you've actually worked on something and changed something, removed something, basically remove the reasons why you actually have high blood pressure and then do things to reduce it. And that's where people misuse medications for high blood pressure. Medicines don't cure high blood pressure because if it did, you wouldn't need to take it every day, folks. The reason why we have over 200 prescription medications just for high blood pressure alone is because it doesn't cure high blood pressure. Antibiotics cure infections. And that's why we don't have 200 different antibiotics because most people don't need to take it for life for people to profit. So by definition, if you need to take something for the rest of your life, that's not a cure. And that's why Big Pharma invests a ton of money in medicines that you will take for the rest of your life unless you do something else about it. So if you want to get off your blood pressure medicines, then you have to treat the root cause. And by the way, it's not your genes. Over 90% of why people have high blood pressure is not because your parents and your grandparents gave you bad genes. Yeah, they may have had high blood pressure. That's because your parents and grandparents lived and ate the food and lifestyle to earn it. And if you pick up their foods and lifestyle, you too will have their high blood pressure. Nearly 1 in 2 American adults have high blood pressure, and roughly 3 out of 4 don't have it under control. We now have more medications than ever. They can be life-saving in a crisis, but nearly half of people who are taking a medication, they need more than one drug. That tells us something really important. High blood pressure is not just a number to push down. And if you don't naturally get your body in a happy, calm, balanced state through food and lifestyle, then your body will fight against the unnatural states that medicines are inducing. And if the root cause aren't addressed, well, you're going to easily ignore the damage that it's causing every day to your body, including silent kidney disease, silent heart disease, and silent strokes. So by taking medications, we effectively want a shortcut to lower a number, which may be appropriate in a crisis. And unfortunately, there's no shortcuts for health and longevity. So if you think about it, uncontrolled high blood pressure, it removed our US president exactly at the moment the world was deciding how to end World War II. So when you ask yourself, my blood pressure is normal, should I stop my medication? The question is, do you really want to take the chance and make it go back up if you haven't put in the effort to foster the right environment for you to be successfully off? Normal on medication does not mean cured. If your blood pressure is normal because of the medication, that number is not proof that you no longer need the medication. It may be proof that the medication is protecting you in the meantime for the time being. Now, FDR, I feel sorry for him. He was carrying the pressure of a world war inside his own arteries. And what pressure and burdens do you have in your mind that causes pressure inside your body? Now, I get it. Some people feel terrible on medications like at H. Davis 3034. Thank you for sharing. Yeah, if you are older and have damaged your blood vessels and have had persistently high blood pressure over time, sure, if you take this, a sudden drop will feel terrible. And that's why you need to see your medical doctor and give them feedback. And that's why there is a different target for older patients when it comes to reducing blood pressure number. And yes, everything has side effects. These pills have side effects. Why wouldn't them? Your body has found a hormonal balance that works for you to make you feel good before you took this. So, of course, if you just take this, it's now in an abnormal balance. And so when you take high blood pressure medications, you can feel bad. And that is why you got to talk to your medical provider so that, I mean, they have like 199 other options. So people who struggle, they may find benefit in seeing a blood pressure specialist. Medical doctors who just treat high blood pressure, like cardiologists and nephrologists, they are very good at what they do, and they kind of know the side effects pretty well because that's what they do day in and day out. And they most likely can find one that is more tolerable to you. Meanwhile, you got to work on the root causes. And you'll be surprised how well, if you work on the root causes, you can do to lower your blood pressure, such as work on your sleeping, work on movement throughout the day, lower your foods with added hidden salt, stop your alcohol, reduce your refined starches along with added fats, and target foods like that beet juice and whole foods that are high in nitrates that will reduce your blood pressure without the unwanted side effects of taking medication. And I know I just said a whole bunch of stuff. If you want more details, watch the next video.